Hello everyone, my name is Dr. Gyan Chandra Paudel. I am MD Radiologist and today I am going to present a case of a 16-year female who came in our OPD with a complaint of chronic cough, fever and hemoptysis, for which HRCT chest was done. So HRCT chest shows severe bronchiectasis along with multiple cavities and consolidation in left upper lobe. As you can see, this is the consolidation in left upper lobe. These are the cavities, multiple cavities, along with severe bronchiectasis in left upper lobe. Other associated findings are multiple tiny centrilobular nodules in bilateral lung fields, predominantly seen in left upper lobe. As you can see, also see in right upper lobe and left lower lobe. A few of centrilobular nodules with twin-bud pattern. So this is a case of post-primary pulmonary tuberculosis, which is also known as reactivation TB or secondary TB, which is commonly seen in posterior segments of upper lobe and superior segments of lower lobes. Other stages of tuberculosis are primary pulmonary tuberculosis, which is commonly seen in children, which is mostly asymptomatic, and they are located anywhere in lung, unlike post-primary pulmonary tuberculosis, which is seen in posterior segment of upper lobe and superior segment of lower lobes. The typical finding in primary pulmonary tuberculosis is Ghon lesion, which is actually a caseating granuloma, and Ghon complex, which is a Ghon focus or Ghon lesion with ipsilateral mediastinal lymphadenopathy, and there is another entity known as Ranke's complex, which is actually the calcified form of Ghon complex. So this is a case of Ghon lesion, a well-defined calcified nodule in right middle zone, and there is also a right hilar lymph node, which is Ghon complex, commonly known as Ghon complex. This is a magnified chest X-ray view, which shows Ghon lesion and right hilar lymph nodes, collectively known as Ghon complex. And this is calcified right middle zone nodule and right hilar calcified node, which is Ranke's complex. And other type of tuberculosis is miliary pulmonary tuberculosis, which is uncommon but has poor prognosis. And there are multiple tiny nodules of almost 1 to 3 millimeters in diameters, which are uniform in size and uniformly distributed throughout the lungs. So this is a typical case of a miliary tuberculosis, showing multiple tiny nodules diffusely distributed throughout bilateral lung fields. And other is the late sequelae of pulmonary tuberculosis, which shows fibrosis, bronchiectasis, cavitation, pleural thickening and calcification, calcified lung nodules, calcified mediastinal and hilar lymph nodes, lung parenchymal destruction and volume loss. This is actually the late sequelae of pulmonary tuberculosis. This is HRCT chest showing severe fibrosis of right upper lobe along with traction bronchiectasis with pleural thickening, and few cystic changes are noted in left lung field. This is yet another post-TB sequelae, which shows severe fibrobronchiectasis changes in left lung with volume loss. So this is the end of today's presentation.